Thomas Baldrick, joined by Robert Andtbacka, MD, from the Huntsman Cancer Institute at the University of Utah. Thanks for being with us.
Thank you.
Tell us about the clinical trial and overview of what's being presented here at ASCO.
Very good. We are presenting the phase 3 study of the OPTiM study, which is a randomized clinical trial between talimogene laherparepvec and GM-CSF in patients with metastatic melanoma.
What's innovative about this immunotherapy?
So this immunotherapy uses a herpes simplex virus, which is the herpes virus that has been modified, and it has been modified to induce the immune system. And what we do with this, we inject this directly into tumors, and when it gets into the tumors, it replicates inside the cancer cells preferentially over normal cells, and then leads to lysis or destruction of the cells, and that activates the immune system locally to fight the melanoma. But it also leads to an activation of the immune system in the rest of the patient's body to fight any melanoma cells that may be circulating in the patient's body.
What was the design of this trial?
So this was a phase 3 randomized clinical trial, and it was a 2-to-1 design. So 2 out of 3 patients received talimogene laherparepvec, and 1 out of 3 patients received GM-CSF. And GM-CSF was injected subcutaneously, whereas the talimogene laherparepvec was injected into the tumors. Patients were then treated with this and followed for response.
What can you tell us about the results of the data?
The results from this study are extremely exciting for us to treat patients with melanoma. This is the first time that we've shown that an oncolytic immunotherapy can receive a durable response rate in patients with melanoma in a phase 3 setting. So in this study, the primary endpoint was durable response rate lasting for 6 months or greater. And what we found from the study was that patients that were treated with talimogene laherparepvec had a 16% long-term durable response rate lasting more than 6 months, compared to 2% of patients in the GM-CSF arm. So the study met its primary endpoint.
What about adverse events?
Very few adverse events. The only grade 3 and grade 4 adverse events were seen in the 2.1% of patients, the most common one being cellulitis. So compared to many other treatments that we have for treating patients with melanoma, this was extremely well tolerated, very few side effects for patients.
Okay. When do you anticipate the overall survival data to mature?
So as you know, as part of this study, there was a planned interim analysis of overall survival. And looking at that planned interim analysis that also was presented here at ASCO today, we can see that there's a trend towards an improvement in survival in patients treated with talimogene laherparepvec. Now, there were 250 out of a planned 290 patients as being part of that overall survival event. So we anticipate that over the next few months, probably towards the end of 2013, we should have the full analysis of overall survival when 290 events have been met.
Come back and see us then, okay?
I will.
Very innovative work. Congratulations.
Yep, thank you.
Dr. Robert Andtbacka, MD, from Huntsman Cancer Institute at the University of Utah, joining us here at ASCO 2013. Well done, sir.
Thank you.